Hi, welcome to HealthTime03. Today we are going to talk about croup. Croup refers to a condition in which a child's windpipe becomes swollen and inflamed. Croup is characterized by a very distinct cough which sounds like a bark. At first, a child may have cold-like symptoms such as a runny or stuffy nose, and after a few days a fever may develop. As the windpipe becomes progressively swollen and inflamed, the child will become hoarse and develop a harsh, barking cough. Croup is most common in children under 5 years old, particularly in those who were born prematurely or with narrow airways. The symptoms of the illness tend to be most severe in children 3 years and younger. Croup is most common in colder countries, particularly during the winter months. Symptoms are usually at their worst 2 to 3 days after the first signs of illness begin, and the illness usually lasts for about 1 week. Children usually recover from croup without any complications. Sometimes, however, complications such as pneumonia and ear infections can develop. With severe croup, the airways become swollen and inflamed to the point where it is difficult to breathe. A child with severe croup will make high-pitched noises when breathing in. The child may also appear blue or pale around the mouth because he or she is not receiving enough oxygen. Croup is most often a viral infection, but can also be caused by bacteria. Your child may contract the virus when an infected person coughs or sneezes. The virus can also survive on toys and other surfaces. If your child touches a contaminated surface and then puts his hand into his mouth or nose, then an infection may ensue. Call your doctor immediately if your child makes high-pitched noises when inhaling or has difficulty breathing. The doctor will examine your child's chest, listen to his breathing with a stethoscope, and examine his throat. Sometimes X-rays and other tests are also used to help with the diagnosis. Breathing in moist air usually relieves most of the symptoms. Try running a hot shower in a closed bathroom to create a steam-filled room where you can sit with your child for 10 minutes. Another way to humidify the air is to buy a cool mist humidifier. This is a small machine that is used to add moisture to the air in homes. Breathing in moist air through the mouth will sometimes break a croup attack. If your child has croup, consider sleeping in your child's room to provide close observation. If you cannot break your child's fast breathing and croupy cough, call your doctor or seek medical attention as soon as possible. Doctors will also sometimes treat croup with steroids, which help with the airway swelling. In cases of severe croup, your child may need to receive oxygen from the hospital. In rare cases, a temporary breathing tube may need to be placed in the child's airway. You prevent croup in the same way that you prevent the cold or flu. Encourage your child to wash his hands often and not to put his hands in his nose or mouth. And of course, keep your child away from anyone who is sick. Okay, here's a recap of some of the things we spoke about today. Croup is caused by the inflammation of the upper airways, which include the windpipe and voice box. A child with croup will have a very distinct cough that sounds like a bark. Children under age 5 are most at risk for croup. Most children recover from croup in about 1 week with no complications. Call your doctor immediately if your child makes high-pitched noises when inhaling or has difficulty breathing. Well, that's it for today. I'll see you again soon.